The 26th of April is National Cancer Clinical Nurse Specialist Day.
It's a huge opportunity for us to celebrate the contribution which these nurses bring to us, our patients, and our hospital. They work tirelessly day in day out to help out our clinicians and patients, and it's an opportunity we need to take to recognize their hard work and celebrate their contribution towards our patients.
The clinical nurse specialists are absolutely imperative to the service of delivery of cancer at Northampton General Hospital. They provide fantastic support for the patients. They act as the patient's advocate, so if there is anything that the patient needs, they know where to get it, and they will get it as fast as they possibly can. And they are a massive source of support to both the patients and us in clinic to make sure that we're delivering the best possible care.
I have been Macmillan Gynae Oncology CNS since May 2004, which makes me one of the Trust's longest standing Macmillan nurses. It's a really special job. It's a privilege to do the job that I do. I absolutely love working with women who've got gynae cancer. You are able to build up a very, very close rapport with the women who are affected, having either surgery, chemotherapy or radiotherapy, and then support them into treatment if they have a recurrence, or living with and beyond treatment in the future. So I've been very lucky to have very long-standing relationships with my patients running into many years, and you really get to know that woman as a whole person, not just somebody who has a label of a gynae cancer.
So I'm Sherilyn, and I'm the Neuro-Oncology CNS here at NGH.
I'm Emma Chapman, and I am the Neuro-Oncology nurse that supports Shez.
Been in post 13 years, and there wasn't a Neuro CNS service when I first came into post. So I've really set it up to reflect, I hope, the needs of patients, where we really get to know our patients. A lot of them we've known for quite several years, which is lovely. And we get to know the families, and certainly in brain cancer patients, a lot of the work is not just the patients, but a lot of the work more is with families, who do need a lot of support, especially if their loved ones is changing, maybe because of cognitive issues or because of treatment side effects. So I think there's quite a lot of work we do that involves families. I think you agree with that, Emily, coming into the job. Yeah. I feel it's very much our role to sort of be there for them and be their advocate, really, not just for patients but for families. So I hope that Em and I are really good patient advocates.
I've always had Shez Macmillan nurse to support. So she, from the day one, she said, okay, this is your situation. She's always been there when, for example, I had a concern. It could be like 2 o'clock in the morning. I'm thinking, oh, I need an answer to this now. What to do? This is like this. I've left a message on answer phone, and I can guarantee by 7:30 in the morning, I get a call back saying, I've got your message, this is where we are. Shez has been like a comfort blanket.
Good morning.
And has continued being that. In the 4 years Liz has been ill, she's always been there. Almost like when things look black, she's the ray of light at the end of the tunnel. I can't explain more than that. She's a diamond in the rough.
I feel like I've learned an awful lot from the nurses over the years because of the way that they can talk to patients and their communication style. I feel like I've been able to learn some of that and bring that into my practice as well. So it feels like a real honour to work with the Macmillan CNSs on a daily basis, and I feel I learn so much from them, and they truly know their patients and value their patients. It's a real privilege to work alongside them and be part of the Macmillan team with them.
I would personally like to say thank you to all the clinical nurse specialists that work here at Northampton General Hospital and in the wider community across Northamptonshire. You do an amazing and fantastic job, and I really value your support. Thank you.
Thank you for everything you do for our patients. You are amazing.